Just want to ask you about the Seniors Advocate report that was released this week. And also, Dr. Henry, you said last week that changes were coming to visitor restrictions for long-term care, and just wondering what changes families can expect and when you think they might happen.
Yeah, I don't have all of the answers to that. We have obviously had ongoing conversations with the Seniors Advocate, and her report is well received. We are working through making sure that we have the appropriate things in place to be able to support increased visitation for those we know who need it and their families. So it is something that we have been working on, and there are many challenges that need to be overcome. Some of them have to do with the PPE and the staffing requirements, and those are coming along, so that's the good news. The more challenging news is, have we seen this week, that we have to be so careful because outbreaks can spread so rapidly in care homes. And it's not just me and my loved one that I need to be concerned about, but it's everybody in that setting. So finding that balance has been the most challenging thing that we have been faced with, knowing that this virus can be so devastating on our elders and seniors.
I have been talking to people who are saying that they don't understand why they have to suffer in areas like Kamloops when they want to be close to loved ones who just want to be touched by their loved ones, who the people that are dying now, many of them are not dying from COVID. They're dying from whatever conditions they already have, and their time is limited. So what can be done to try to make allowances for people outside the Fraser Health region, outside the Lower Mainland, that are desperate to try to spend more time with their loved ones?
And I hear that. I know it's very challenging. We are working with the care home operators, the people who work in the care homes, to make sure that we can put in these measures. As I said, it is the most challenging and wicked problem that we're dealing with.
You know, obviously since June the 28th, when we started we've had consistently essential visitors throughout the pandemic. When we started having what we call regular visits on June 28th, we said we were going to also provide and support the long-term care homes with more supports and more staff, and this is an absolutely necessary precondition of a significant expansion of visits in the pandemic. I think it's pretty clear as to why. And so that effort has gone out. More than $100 million has gone out to support that effort, and we are making really an unprecedented effort when you look at the increase in staffing, which is $110 million to get to the 3.36, the $160 million to support visitation, the 7,000, of which that's part, the 7,000 new healthcare workers that we're putting in place. All of this isn't for other reasons than to improve infection control, improve the quality of life for seniors in long-term care, and of course to support visits. So it's our hope that we can do that soon. But really, as Dr. Henry has said, and I want to emphasize this, this is a week when we've had outbreaks. Our first outbreak, for example, in long-term care in the Northern Health Authority in Dawson Creek, that this can hit us everywhere. And so what we need to think about all over British Columbia is what happens when we take actions to stop the spread. It helps us expand visits in long-term care, because people who work in long-term care and people who visit their loved ones in long-term care, and it's just so that everyone understands, it's my family as well, and I feel it this very personally, that all of that is made possible when we take steps ourselves to stop the spread. So I want people, you know, if they can, to understand the value for other people in what we can do right now to do that. And following the guidance put forward by Dr. Henry and her colleagues is so important, and it is itself an important element of our efforts to increase visits in long-term care. But you may know this is an area for both Dr. Henry and myself where we talk to people regularly, we hear from people regularly, we respond to people who talk to us about it regularly. The survey put forward by the Seniors Advocate told us in that sense what we already know, but it puts out in paper how people are feeling and the powerful impact of that we know. And so the task in this is not just to deal with COVID-19, but whether it's visits in long-term care or other issues in society, the other public health emergency of the overdose crisis, to deal with the consequences of the actions we have to take in pandemic. And that's why it's so important for all of us to recommit to stopping the spread.